Hi everyone. I want to talk to you about hypertension, but specifically hypertension in the young. Well, I have presented the measures to take to get the correct blood pressure. If you haven't listened to that, please check it out. How to accurately measure your blood pressure. So, when we find out that a young man or young woman is having hypertension, we become troubled. It is not that we are happy when elderly people are coming down with hypertension, but the older you are, the higher your blood pressure, respectively. But when young people, 25, 35, 40, 45, are coming down with hypertension, then we need to run. Why? We need to look for the cause. So hypertension in the young could be essential hypertension or idiopathic when we don't know the cause. And it could just be like that, primary hypertension, you know, in some people because it is prevalent in the family, so on and so forth. But most of the time, when younger age people, male or female, come down with hypertension, then there's likelihood of a cause somewhere. So we call it secondary hypertension. Now, the big question is secondary to what? Okay, let's go. One, renal or kidney problem. It could be renal artery stenosis. It could be polycystic kidney disease. It could be renal parenchyma disease. It could be pyelonephritis. So we'll look around the kidney and find out whatever is happening. You do the laboratory or do radiological or do everything to make sure this problem is not coming from the kidney. Okay, here we go. My young boys, my young men, young girls, young ladies, street drugs is not good for you. I have some presentations on some of the major or common street drugs already. Have a time to check them out, and you realize that I have emphasized, beyond doubt that cocaine in particular, and most of other street drugs that have been adulterated will shoot your BP up, will kill you. Yes, street drugs will kill you. So cocaine in particular will kill you. Don't do it. Endocrine Pheochromocytoma. This will present like episodic kind of a problem with episodic headache, sweating, heart racing fast, and of course the BP is up. Cushing syndrome, some call it Cushing's disease. I will make a separate presentation on that. Oral contraceptives. Young ladies, young women, you are taking those medications, be aware it could shoot your blood pressure up. Hyperthyroidism, you feel hot more than necessary compared to the rest. Then hyperaldosteronism, coarctation of the aorta. Usually that is a congenital problem, and the older will become, the more obvious the symptoms of it. So coarctation of the aorta. The list is not over yet. There's what we call white coat hypertension. That that doesn't mean it is limited to younger age group, no. But then we want to know why this young woman or young man or young woman are having this trouble. White coat hypertension or liver hypertension is high only at the clinic and normal afterward. So the best thing we could do is 24-hour monitoring, and that will fall short of diagnosis of hypertension. So with white coat hypertension, the patient is having high blood pressure while meeting the doctor or the nurse at the clinic or the hospital, but once they're out, the problem is out, the BP is normal. Marked hypertension, just from the English word marked. Now, hypertension is covered. Now, it's not seen because the BP is only increased outside the clinic, but normal while with the doctor. So that could be dangerous because the doctor or the nurse would not be able to say that this patient is hypertensive. So 24-hour monitoring will also help in making that diagnosis. Drug-induced, this time around, medications prescribed or over-the-counter like non-steroidal anti-inflammatory drugs like ibuprofen can precipitate it. Tricyclic antidepressants for those taking it for neuropathic pain or fibromyalgia or for depression. Then monoamine oxidase inhibitors with theramine-containing compounds ingested, we're in trouble. Steroids for any reason, particularly those who are using it to get high, to get more energy, and so on and so forth, you are at risk of coming down with hypertension, please. Over-the-counter decongestants with pseudoephedrine could transiently shoot the BP up while you are named. And of course, lithium as a mood stabilizer will not spare the user when it comes to hypertension. Metabolic derangement. Decreased potassium will favor high blood pressure. And of course, calcium increase will elevate the BP. That's why we give calcium channel blockers in some situations. Increased sodium, when you use the non-steroidal anti-inflammatory drugs like ibuprofen, your Advil, and you retain more sodium and water, then you have high blood pressure. Like the reason why we give diuretics to push out the fluid. Congenital adrenal hyperplasia, too much alcohol consumption, and increased salt intake. Neurological problems are not left out, like tumor of the brain, stroke, subarachnoid hemorrhage, and Guillain-Barré syndrome. Obstructive sleep apnea, report and seek appropriate management. Psychosocial stressors like panic attack, post-traumatic stress disorder will shoot your BP up. In conclusion, when a young person is having a high blood pressure, we have to rule out all possible causes because mostly it is secondary to one pathology in the system or more. So please, young men and women, your BP is high, your doctor has made that determination that you are hypertensive, please cooperate, get all the possible workup, and let them get to the bottom of the problem. Thank you for listening to my presentation. Kindly subscribe to my channel so that you can be getting these videos as soon as they are published. Thank you.